Hello guys, good evening. I welcome you all on Unacademy, India's largest learning platform. Myself, Dr. Nidhi, I am alumni of King George Medical University, KGMU Lucknow. I am teaching you all physiology. अगर नीट पीजी पॉइंट ऑफ व्यू से बात करेंगे तो काफ़ी अच्छा वेटेज रखता है. On an average 15 question come in our examination यानी scoring subject है. So everybody clear the concept so that you can score more examination and you will be able to achieve your target with good rank. This is our page on Telegram. That is Let's Crack Neat PG. Follow us out there so that you will get link of every classes out here. This is my page on Unacademy. Description में आपको link भी मिल जाएगा. This is my page unacademy.com at this unacademy.com/KGMC. Follow me out there so that you will get notification of every class and you won't miss a single class. This is the code Dr. Nidhi. If you want to join any paid course, you can use this referral code to get additional 10% off. I've taken many plus classes, many special classes, so anytime you can join and revise the topic. Now coming to this free test calendar. So we are left with this free test. So if you are serious about your examination, do give the test, because test देने से क्या होता है, आप अपने preparation को analyze करते हो, कहाँ आप weak हो, कहाँ आप strong हो, उसको analyze करते हो, उससे according आप revision करते हो. So do give this test if you are serious about your examination. For that you have to use the code Dr. Nidhi. इस कोड को अप्लाई कर दिया, आपका सारा फ्री ऑफ कॉस्ट ये टेस्ट ओपन हो जाएंगे. तो डू रिमेंबर द कोड दैट इज डॉक्टर निधि. सो वी आर ऑल्सो गोइंग टू हैव दिस ऑल इंडिया मॉक टेस्ट इफ यू आर टारगेटिंग दिस नीट पीजी 2022. So do give this mock test. This mock test is going to show your all India rank predictions. This all India mock test is going to happen on 27th March 9 a.m. Do remember the date and timing. Out here also you have to enroll yourself. First of all, for enrollment use the code Dr. Nidhi. We are launching this previous year question bank on 23rd March, जिसमें डेडिकेटेड सेशन होगा प्रीवियस ईयर क्वेश्चंस के लिए. नीट पीजी, INRCT, FMG, all examination question will be covered. Past 3-year paper will be solved, enhanced solution explanation for better understanding of concept, and this is going to give you the quick revision of your examination. And we are also going to start this launching our MBBS professional was. यहाँ पे आपको पूरे डेप्थ में आपके टॉपिक कवर कराए जाएंगे. इंटीग्रेटेड सेशन होगा, आंसर राइटिंग सेशन होगी, सब्जेक्ट वाइज टेस्ट होगा एवरी सैटरडे, जिसको हम डिस्कस करेंगे ऑन द मंडे. फुल सब्जेक्ट वाइज टेस्ट होगा आफ्टर द कंप्लीशन ऑफ ईच सब्जेक्ट. लाइव इंटरैक्टिव क्लासेस होंगे, डाउट क्लियर सेशन होंगे, रिकॉर्डेड सेशन भी अवेलेबल होंगे. अगर आप सेशन मिस कर देते हो तो PDF notes are also available. So if you are an MBBS professional 1, so you can enroll yourself in this batch. So now coming to the subscription, we have two type of subscription, plus subscription as well as iconic subscription. First coming to this plus subscription, what all are the benefit? If you take the plus subscription, you are able to access both live and recorded session. किसी वजह से आपका सेशन मिस हो जाता है तो आप रिकॉर्डेड सेशन देख सकते हो. Yeah, that would be having no issue, Dr. JJ. ठीक है, लिमिट लाइव सेशन अगर मिस हो जाता है तो आप रिकॉर्डेड सेशन देख सकते हो. यू हैव एन अपॉर्चुनिटी टू लर्न फ्रॉम इंडियाज टॉप एजुकेटर फॉर द मेडिकल एग्जामिनेशन. वी ऑलवेज कंडक्ट दिस लाइव टेस्ट एंड लाइव क्विजेस. फ्रॉम दैट यू कैन एनालाइज योर प्रिपरेशन at any point of time. You have a flexibility, you can study on the device of your choice. आपका फ़ोन हमेशा आपके साथ होता है तो आप फ़ोन से एक्सेस कर सकते हो. इफ़ यू वांट टू गो फॉर द बिगर स्क्रीन, यू कैन गो फॉर द बिगर स्क्रीन ऑल्सो. वी हैव अ क्वेश्चन बैंक विच कंसिस्ट ऑफ 25,000 प्लस क्वेश्चन. High yield question है, clinical based question and with explanation है. So this is going to be very beneficial for all of you. Now coming to the iconic subscription, where you get access of India's two best platform, that is Unacademy and the Prep Ladder. So you are going to get all the benefit of Unacademy. Like I said, live classes, recorded classes, question bank, live tests and live quizzes. Along with that, you get access of Prep Ladder also. In this, you can access the clinical and integrated essential of Prep Ladder, video lecture from the dream team, question bank 3.0, rapid revision and snapshot, and you will also be provided with the treasure and dream notes. So if you want to access the prep ladder also, go for the iconic subscription, everybody. They are our FMG December 2021 topper. Special class फीचर की अगर बात करेंगे तो आज स्पेशल क्लासेस स्पेशल बिकॉज इट इज़ ऑलवेज एंड ऑलवेज लाइव क्लासेस का बेनिफिट ये होता है कि आप अपने एजुकेटर से 1-to-1 इंटरैक्ट कर सकते हो, अपने डाउट को लाइव सेशन में क्लियर कर सकते हो। पोल्स के फीचर होते हैं जिससे क्लास काफ़ी इंगेजिंग होता है। रेज हैंड फीचर इज देयर, नाउ यू कैन टॉक टू एजुकेटर इन द लाइव सेशन। अगर किसी एजुकेटर को फॉलो करते हो तो उनके क्लास से प्रायर आपको नोटिफिकेशन मिल जाता है। After the lecture, you can download the PDF and revise it anytime, anywhere. So we are going to start this high yield theory revision batch for the NEET PG 2022. 30th मार्च को स्टार्ट होगी, 15th मई तक इसकी क्लासेस चलेंगी, यानी इन ऑन ऑल टोटल जो ड्यूरेशन होगा दैट इज ऑफ 1.5 मंथ। 140 आवर्स ऑफ रिविजन क्लासेस होंगे, रिकॉर्डेड क्लासेस होंगे, 2 ग्रैंड टेस्ट होंगे, क्वेश्चंस बैंक होंगे, लाइव इंटरैक्टिव सेशंस होंगे, PDF नोट्स होंगे। So if you are targeting this NEET PG 2022, do enroll yourself in this batch. We are also going to start this high yield revision and MCQ batch for FMG this 2022. ठीक है, ये भी हमारा 30th मार्च को स्टार्ट होगा एंड इट इज गोइंग टू लास्ट टू 38th May, 2 months इसकी ड्यूरेशन होगी। इन दिस वी आर गोइंग टू हैव दिस ग्रैंड टेस्ट, सब्जेक्ट टेस्ट, रिकॉर्डेड क्लासेस, क्वेश्चन बैंक, PDF and in live interactive sessions will be there. So if you are targeting this FMG 2022, you can enroll yourself in this batch. Fee structure is somewhat like this. For plus subscription, it is somewhat like this. For iconic subscription, it is somewhat like this. For light subscription is newly added one, जहाँ पे आप सारे टेस्ट दे सकते हो, बहुत ही इकोनॉमिकल प्राइस पे है। 2 मंथ की फीस है 2160, 3 मंथ की फीस है 2700, 6 मंथ की फीस है 4860, 9 मंथ की फीस है 5400, 1 ईयर की फीस है 5940। सो काफ़ी इकोनॉमिकल प्राइस में आपको प्लस सब्सक्रिप्शन मिल रहा है, आइकॉनिक सब्सक्रिप्शन मिल रहा है, प्लस लाइट सब्सक्रिप्शन मिल रहा है। अपनी रिक्वायरमेंट के हिसाब से यू कैन परचेज योर द सब्सक्रिप्शन, ठीक है। So moving further to our topic, today we are going to revise about the pancreas and the calcium homeostasis. First coming to the pancreas. This is the diagram. The pancreas consists of 3 regions: tail, body and the head region. ठीक है, तो इसी को हम देखते हैं। फर्स्ट कमिंग टू द इंट्रोडक्शन, 98% एक्सोक्राइन होता है हमारे पैनक्रियास का, रेस्ट 2% इज इंडोक्राइन। इंडोक्राइन पार्ट जो पैनक्रियास का होता है दैट इज कंसंट्रेटेड इन द टेल रीजन, एंड इन टेल रीजन देयर इज दिस island like cell which is known as islet of Langerhans cells that consists of the endocrine part of pancreas. This islet of Langerhans cell consists of different types of cell: alpha cell, beta cell, PP cell. First coming to the alpha cell. This alpha cell is present at the outer rim of this islet of Langerhans, and they are going to release this glucagon. What does glucagon do? It increases the blood glucose level. Next is the beta cell. This beta cell is present. Alpha cell was present at the outer rim. Beta cell is present at the center of islet. This beta cell is responsible for production of insulin, amylin and C-peptide. What does insulin do? It decreases blood glucose level. What does amylin do? It potentiates the action of insulin. What does C-peptide do? It is an endogenous insulin marker. So insulin is to C-peptide ratio is 1:1, means insulin is equally produced in our body with the C-peptide. They all both are produced in an equimolar ratio. Do remember this point. Insulin and C-peptide are produced equally in our body. So that's why we do the C-peptide assay to measure the insulin produced in our body. Is this clear? So beta cell is going to produce insulin, amylin and C-peptide. Next cell, that is, this is the diagram. This is the alpha cell which is going to produce glucagon. This is the beta cell which is present at the center of islet of Langerhans, and they are responsible for production of insulin, amylin and C-peptide. Next is the delta cell, and we have this PP cell. Now coming to the delta cell. This delta cell is dispersed in our islet of Langerhans, and they are responsible for production of somatostatin. And we all know somatostatin is a universal inhibitor. Next cell, that is F cell. This F cell is responsible for production of pancreatic polypeptides. Next, this point is also important. Beta cell are maximum in number. They are 55% in our islet of Langerhans, and the T half of insulin is 4 to 6 minutes. Is this clear with everybody? Moving further to the detail of insulin, how it is produced, what all are the action of this insulin. This insulin was discovered by Banting, MacLeod and Best, and they got Nobel Prize for this discovery. This insulin is the first protein to be structure sequenced completely. Okay? And that was done by the Sanger. This is the first protein to be produced successfully by recombinant DNA technology. Okay? Next point, insulin is always stored along with the gene. What does zinc do? Zinc ensure the stability of insulin structure. Okay? Zinc के साथ क्यों store होता है? Because it is going to provide stability to the insulin structure. Now coming further, insulin formation is done by this transcription factor, that is hepatocyte nuclear factor. So whenever there is mutation in this hepatocyte nuclear factor, insulin production will decrease, and that is going to cause this maturity onset diabetes of young, which is also known as MODY. Is this clear? So maturity onset diabetes of a young क्यों होता है? Because of this mutation and this transcription factor, that is hepatocyte nuclear factor. Moving further to the insulin release, how insulin is released from beta cell of pancreas. So 4 important steps in this releases are: first is the GLUT2, which is acting as a glucose sensor. Second is the closure of ATP sensitive potassium channel. In next step, the voltage gated calcium channel open up, and that causes exocytosis of insulin. So what happened? Suppose this is our beta cell of pancreas. This is our blood vessel. And this is the beta cell. So whenever the glucose level increases in our blood, it is sensed by GLUT2, which is present at the basolateral end of beta cell. This is the GLUT2, and glucose uptake is done by this GLUT2 to the beta cell. So glucose enter the beta cell. So due to the entry of this glucose, what happened? This beta cell consists of ATP sensitive potassium channel, और ये जो ग्लूकोज एंटर किया है उसकी ग्लाइकोलाइसिस होगी, ATP will be generated and this ATP sensitive potassium channel get closed, and due to that क्या होगा? Potassium efflux will stop. So potassium is going to accumulate inside the cell, and positive ion is accumulating inside the cell. So what is going to happen? Membranal depolarization will be there, और जैसे ही हमारा membrane potential -40 millivolt reach करेगा, voltage gated calcium channel open up, and due to that क्या होगा? Calcium influx होगा, and calcium is going to bind with the insulin vesicle, and exocytosis of this insulin occur. So this is the process जिससे हमारा insulin release होता है from the beta cell. Is this clear with everybody? Do reply fast. Is this clear? Moving further, so first coming to this GLUT2 is present at the basolateral end of beta cell. They act as a glucose sensor. So whenever the glucose increases in our blood, it causes diffusion of that glucose from our blood vessel to the beta cell, and this diffusion is via the facilitated diffusion, यानी passive process हो गया. Now the whole step, whenever the glucose is increased in our blood, तो ग्लूकोज हमारा सेल में इंटर करेगा, बीटा सेल में, एटीपी विल बी रिलीज, this ATP sensitive potassium channel get closed, potassium level inside the cell is going to increase because potassium efflux क्या हो जाएगा, stop हो जाएगा, RMP जैसे ही -40 मिलीवोल्ट पे पहुंचेगा, voltage sensitive calcium channel open up, calcium influx होगा, calcium along with the ATP and its near protein is going to cause exocytosis of this insulin vesicle. Is this clear with everyone? Moving to the diagram, this is our GLUT2 which is present at the basolateral end. So this is our blood vessel. Glucose enter inside the beta pancreatic cell. Hamara ATP will be released and ATP is going to bind with the ATP sensitive potassium channel. So that causes closure of this channel. Potassium accumulation starts. That is going to cause membranal depolarization. And due to membranal depolarization क्या होगा, voltage gated calcium channel open up, calcium influx is there, and that is going to cause exocytosis of insulin vesicle. Is this clear with everyone? So this GLUT2 is important, which is acting as a glucose sensor in beta pancreatic cell. So now coming to the clinical aspect, like insulin secretagogues like sulfonylurea, they are going to close this ATP sensitive potassium channel. So उसकी वजह से क्या होगा, ATP sensitive potassium channel get closed, तो इंसुलिन क्या होगा, ज़्यादा से ज़्यादा रिलीज होगा. So that's why the insulin secretagogues are used in the treatment of diabetes mellitus. Is this clear, everyone? Clear हो रहा है? Session में किसी को कोई doubt? Anybody, anywhere till now? You can ask in the session only. जल्दी रिप्लाई कीजिए, किसी को भी कोई डाउट है तो क्लियर कर सकते हैं. So moving further to the next clinical aspect, that is digoxide. This digoxide, what does it do? It open up the ATP sensitive potassium channel. So what happened? Insulin release will decrease. So that's why this digoxide is used in the treatment of insulinoma. Is this clear? Moving further to the mechanism of action of insulin. Insulin acts via which receptor? They act via extracellular receptor. And which extracellular receptor? It acts via tyrosine kinase receptor, which is also known as insulin receptor. So this point is important. They act via insulin receptor, which is a tyrosine kinase receptor. किस टाइप का रिसेप्टर होता है? ये एंजाइमेटिक रिसेप्टर होता है. इट कंसिस्ट ऑफ 4 यूनिट, 2 अल्फा एंड 2 बीटा यूनिट. ओनली बीटा यूनिट इसमें जो है उसी में सिर्फ टायरोसिन काइनेज एक्टिविटी होती है. एंड दिस एक्शन ऑफ इंसुलिन इज डन बाय दिस रिसेप्टर एंड दिस रिसेप्टर इज प्रेजेंट इन only 3 tissue, our cardiac tissue, our skeletal muscle as well as our adipose tissue. So this tyrosine kinase receptor is present in our cardiac tissue, skeletal muscle and adipose tissue. Is this clear? Moving further, so what will insulin do? Insulin upregulate this GLUT4. This is important. This is a which glucose transporter is insulin mediated? Our GLUT4 is insulin mediated, and this GLUT4 is present in 3 organs: our cardiac tissue, our skeletal muscle as well as in adipose tissue. So this insulin is going to upregulate the glucose entry in these 3 organs, so that is why it is going to decrease the blood glucose level. ठीक है? Insulin and move along potassium ion also along with the glucose. So that's why जब हम इंसुलिन को डेक्सट्रोज के साथ देते हैं तो it is used in the treatment of hyperkalemia because glucose uptake, इंसुलिन क्या करेगा? ग्लूकोज का अपटेक कराएगा, डेक्सट्रोज अपटेक will be there, and along with that क्या होगा? पोटेशियम आयन also move inside the our ग्लूकोज के साथ साथ क्या होगा, पोटेशियम आयन also move inside the organs, and that's why hyperkalemia will be treated. So that's why hyperkalemia में we give this insulin plus dextrose. Everybody, is this clear? So this point is important from exam point of view. Do you remember, everybody? Moving further to the diagram, what is the effect of insulin on glucose uptake? Insulin upregulate the GLUT4 in 3 organs. कौन-कौन से organ? Do reply fast. In the cardiac tissue, in a skeletal muscle, cardiac muscle, skeletal muscle, and adipose tissue. So insulin upregulate the GLUT4 in these 3 organs: cardiac muscle, skeletal muscle, and adipose tissue. So moving further to the metabolic action, insulin is major anabolic hormone. Major catabolic hormone is, anybody? The major catabolic hormone is, do you reply fast? The major and catabolic hormone is thyroid hormone. Major anabolic hormone is insulin. Insulin act like a hormone of insurance. How would it act like a hormone of insurance? Because on carbohydrate ये क्या करता है, glycogen synthesis को promote कराता है. It inhibits the glycogenolysis and new glucose formation. On fat पे कैसा action है? Lipogenetic action. It causes lipolysis. On skeletal muscle पे कैसा action है? It causes proteogenesis. ठीक है, lipogenesis कराता है, proteogenesis कराता है, glycogen synthesis कराता है. So that's why it is known as major anabolic hormone. Is this clear? So now coming to the important parts, the regulation of this insulin secretion. There are some factors that will increase this insulin secretion. There are some factors that decreases this insulin secretion. First, coming to the factor that increases this insulin secretion. In this, we have increase in blood glucose level. Obviously, is going to increase the insulin. Glucagon. Glucagon, what does it do? It increases the blood glucose level. So blood glucose level increase hoga, insulin secretion will increase. Our GI hormone like incretin, which is also known as glucagon like peptide 1, it is also going to increase the insulin secretion. Do remember. GLP-1, it is also known as glucose dependent insulinotropic peptide. ठीक है? So this is going to increase the insulin secretion. So that's why exenatide, which is an analog of glucagon like peptide, so it is also going to increase the insulin production. Next is the DPP4. What does this DPP4 do? It degraded this GLP-1. So what happened? GLP-1 decrease हो जाएगा, insulin production is going to decrease. So that's why we use this DPP4 inhibitors like our gliptins. Gliptins क्या करेगा? DPP4 को inhibit करेगा, तो glucagon like peptide 1 का production क्या हो जाएगा? That is going to increase, and that is going to increase the insulin secretion, and that's why gliptins are used in the treatment of diabetes mellitus. This point, is this clear? समझ में आया? Everybody, DPP4 क्या करता है? Glucagon like peptide को inhibit करता है. So DPP4 inhibitor like our gliptin is going to increase the GLP-1. So insulin production will increase. ठीक है, नेक्स्ट बात करेंगे गैस्ट्रीन. गैस्ट्रीन हार्मोन इज गोइंग टू इंक्रीज द इंसुलिन प्रोडक्शन. सिक्रेटिन हार्मोन इज गोइंग टू इंक्रीज द insulin production. Cholecystokinin also increases the insulin production. Next, coming to the factor that decreases the insulin secretion. In this, we have somatostatin, which is a universal inhibitor. So it is also going to inhibit the insulin secretion. Next is the digoxide and the hypokalemia. All these situations is going to decrease the insulin secretion. Is this clear with everyone? Do reply fast. Moving further, what is the effect of autonomic nervous system on insulin secretion? Parasympathetic nervous system, or you can say acetylcholine or the vagal stimulation, is going to increase the insulin production. Sympathetic nervous system via the alpha 2 receptor क्या करता है, डिक्रीज करता है इंसुलिन प्रोडक्शन को, और बीटा 2 receptor के थ्रू इट इज गोइंग टू इंक्रीज द इंसुलिन सिक्रीशन. बट अगर ओवरऑल एक्शन की बात करेंगे तो दैट इज वाया अल्फा 2 receptor, दैट इज इंक्रीजेस द इंसुलिन सिक्रीशन. So do remember, parasympathetic nervous system is going to increase the insulin production. Sympathetic nervous system is going to decrease the insulin production. Is this clear with everyone? Moving further to the counter regulatory hormone. There are some hormones that act opposite to the insulin. They are known as counter regulatory hormone. So these hormones are going to increase the glucose level. So hormone which increases the glucose level are known as counter regulatory hormone. So we have this growth hormone, it also increases the glucose levels, so that's why it is also known as anti-insulin hormone. The glucagon, it is going to increase the glucose level. Cortisol, it promotes the gluconeogenesis, so that's why it is also a hyperglycemic one. Epinephrine is also going to increase the glucose level, so that's why these four hormones are counter-regulatory hormone. This point is very important from the exam point of view to remember, everybody. Moving further to the diagram, insulin and its counter-regulatory hormone. Counter-regulatory hormone are growth hormone, cortisols, glucagon, and the epinephrine. Is this clear with everybody? Chalo, moving to the next topic, that is calcium homeostasis. First, coming to the introduction, that is normal serum calcium कितना होता है हमारा 8.7 से लेके 10.2 मिलीग्राम पर डेसीलीटर. इसमें जो 50% कैल्शियम है वो हमारा एक्टिव फॉर्म में होता है, फ्री कैल्शियम होता है, आयनिक कैल्शियम होता है, डिफ्यूजिबल कैल्शियम होता है. ठीक है, 50% इज एक्टिव क्योंकि ये फ्री फॉर्म में होगा, आयनिक फॉर्म में होगा, डिफ्यूजल फॉर्म में होगा. सो दैट्स वाई 50% कैसा है, एक्टिव फॉर्म है. रेस्ट की बात करेंगे तो 41% इज नॉन एक्टिव बिकॉज इट इज इन दिस फॉर्म ऑफ स्टोरेज, यानी प्रोटीन बाउंड किसी से बाइंड है, इसीलिए ये हमारा नॉन एक्टिव फॉर्म है. तो किस प्रोटीन से बाइंड होता है हमारा कैल्शियम, हमारा कैल्शियम जो बाइंड होता है दैट बाइंड्स विद द एल्ब्यूमिन. 9% क्या होता है, कॉम्प्लेक्स विद द एनायन like citrate, phosphate or the bicarbonate. Is this clear? तो 50% क्या है, एक्टिव है, फ्री फॉर्म में है, डिफ्यूजिबल फॉर्म में. 41% नॉन एक्टिव है बिकॉज इट इज प्रोटीन बाउंड. 9% complex with the anion like citrate, phosphate or the bicarbonate. So this is the diagram. Ionized calcium कितना है, 50%. This is only the free form or active form. ठीक है, प्रोटीन बाउंड किस प्रोटीन से बाउंडेड होता है, एल्ब्यूमिन से बाइंडेड होता है, एंड इट इज 41% एंड इट इज इनएक्टिव फॉर्म, एंड रेस्ट 9% इज बाउंडेड विद द एनायंस. इज दिस क्लियर विथ एवरीबॉडी? कमिंग टू दिस फ्लो चार्ट, टोटल बॉडी कैल्शियम की अगर बात करेंगे तो इट इज 1 to 1.3 kg. बॉडी फ्लूइड के फॉर्म में 1% होता है, रेस्ट 99% हमारा बोन में होता है. अब बॉडी फ्लूइड का एक डिस्ट्रीब्यूशन देखेंगे तो ECF में 0.1% होता है, ICF में इंट्रासेलुलर फ्लूइड कंपार्टमेंट में जो कैल्शियम का लेवल होता है वो होता है 0.99%. ठीक है, ECF की बात करेंगे तो वो प्लाज्मा के फॉर्म में हो सकता है और इंटरस्टिशियल फ्लूइड के फॉर्म में हो सकता है. और प्लाज्मा में डिस्ट्रीब्यूशन वी ऑलरेडी स्टडीड कि 50% हमारा प्रोटीन से 50% हमारा फ्री होता है और हमारा जो 41% है that is binded with the protein like albumin and the globulin, and rest 9% is complex with the anion like citrate, phosphates. This is the distribution of calcium in our body. Everybody, is this clear? Do reply fast. चलो मूविंग फर्दर. So now coming to the level of free or bound form of calcium जो है वो determined होता है two factors से, presence of albumin in our body and the blood pH. So what happened during acidosis? Acidosis है यानी हमारी body में क्या है, H plus ion is more. So this H plus ion is going to bind with the albumin. So free albumin क्या हो जाएगा इस situation में, decrease हो जाएगा. तो calcium क्या होगा हमारा, free calcium increase हो जाएगा. Is this clear? So acidosis situation में हमारा कैल्शियम इंक्रीज हो जाएगा एंड while in alkalosis situation क्या होगा, हमारा H plus ion is less, so albumin हमारा free albumin ज़्यादा होगा, that is going to bind with the calcium, so free calcium in this situation is less and that is going to cause hypocalcemia. अगर hypocalcemia बहुत severe है तो it can lead to the tetany. So alkalosis situation में क्या हुआ, हमारा टिटैनी होने के चांसेस है. एसिडोसिस सिचुएशन में क्या है, फ्री कैल्शियम ज़्यादा है, अल्कलोसिस सिचुएशन में फ्री कैल्शियम इज लेस. मूविंग टू द टिटैनी, फर्स्ट मैनिफेस्टेशन अकर व्हेन कैल्शियम लेवल डिक्रीजेस मोर देन 7 मिलीग्राम परसेंट एंड डेथ कैन अकर व्हेन इट डिक्रीजेस मोर देन 6 मिलीग्राम परसेंट. ठीक है, फर्स्ट मैनिफेस्टेशन अकर व्हेन calcium decreases more than 7 milligram percent and death can occur when calcium decreases more than 6 milligram percent. ठीक है, in this we get this carpopedal spasm and facial muscle spasm. Carpopedal spasm is also known as trousers signs. So this is the trousers signs. इसमें क्या होता है, जैसे ही हम कफ को इन्फ्लेट करते हैं, बीपी कफ को, तो there is the carpopedal spasm. ठीक है, and this is the indication of tetany. ठीक है, and when it tap the facial area, there is a facial muscle spasm that is known as positive Chostek signs. This is also seen during the tetany. So tetany की situation में we will get this two sign, trousers sign and Chostek sign. Moving further to the calcium regulation, we require 3 hormones and 3 organs. 3 hormones are parathormone, vitamin D, calcitonin. In this, the parathormone and vitamin D is going to increase the calcium level while calcitonin decreases the calcium level. ठीक है, कैसे इंक्रीज करता है, कैसे डिक्रीज करता है, we will discuss that one. And for calcium regulation, we require 3 organs: bone, GIT, and the kidney. First, coming to our parathormone. This parathormone is produced by parathyroid gland, and in parathyroid gland we have this chief cell. 2 types of cell are there. Parathyroid gland consists of chief cell and oxyphilic cells. This chief cell is going to produce this parathormone. This parathormone is a peptide hormone which is made up of 88 amino acid. And drug form अगर parathormone की बात करते हैं तो that is teriparatide. Is this clear, everybody? So this is the diagram showing our parathyroid gland. Left parathyroid gland and right parathyroid gland. Is this clear? The form of parathormone is teriparatide. Moving further to the action of parathormone. First is on the bone. Parathormone receptor कहाँ present होता है? It is present in osteoblast. So osteoblast से parathormone bind करेगा, it is going to produce this rank ligand. Rank ligand क्या करता है? Act on osteoblast और osteoblast की activity को decrease करता है and it is going to increase the differentiation of osteoclast. ठीक है, receptor कहाँ present है? Osteoblast पे present है. Osteoblast is going to produce rank ligand. This rank ligand is going to increase the differentiation of osteoclast and that is going to cause bone resorption. And due to bone resorption क्या होगा? हमारा जो hydroxy apatite crystals हैं bone में वो break down करेंगे. Calcium and phosphate will be released in the blood. So on the bone पे अगर action की बात करेंगे तो it is going to increase the calcium level, it is going to increase the phosphate level. So now coming to the clinical aspect, so rank ligand blocker like denosumab is used in the treatment of osteoporosis. ठीक है, bone resorption is mediated by acid proteases that is present in osteoclast. Is this clear? Hydroxyapatite crystal breakdown करेगा in the presence of this acid proteases, तो calcium and phosphate level in our blood will going to increase. Next, action of this parathormone on the kidney. What does parathormone do in the kidney? It inhibits this sodium phosphate co-transporter. So that's why phosphate excretion in the PCT occurs. ठीक है, and calcium reabsorption from the DCT occurs in the presence of this parathormone. So parathormone का action on the level of kidney बात करेंगे तो it is decreasing the phosphate level. So it is known as phosphate terminating hormone or phosphatonin, because it is decreasing the phosphate level. So that's why it is known as phosphate terminating hormone or phosphatonin. So moving to the function on the GIT, action of parathormone on the GIT. So on GIT it has indirect action. What does it do? It potentiates the action of vitamin D. ठीक है, विटामिन डी क्या करता है? कैल्शियम रीअब्जॉर्प्शन फ्रॉम प्रॉक्सिमल और स्मॉल इंटेस्टाइन कराता है. So that's why this our parathormone is also going to cause calcium reabsorption from proximal small intestine. So what will be the overall action? Overall action is increase in the calcium level and it decreases the phosphate level. Everybody, is this clear? कि overall action कैसे आया? It increases the calcium, it decreases the phosphate. Everybody, is this clear? So it is going to increase the calcium level in our serum and it is going to decrease the phosphate level in our serum. So this is the overall action of parathormone. Now coming to the next, that is vitamin D. First we will discuss about the synthesis of vitamin D. Seven dehydrocholesterol which is present in our skin when it is exposed to UVB जिसकी वेवलेंथ है 280 to 320 नैनोमीटर, तो विटामिन D3 फॉर्म होता है which is an inactive form of vitamin D. When liver से एंजाइम आता है 25 हाइड्रोक्सिलेज तो हमारा फॉर्म होता है 25 हाइड्रोक्सिल विटामिन D3 which is also known as calcidiol. It is the main storage form. Do remember this is the calcidiol. ठीक है, माइनर पाथवे से हमारा फॉर्म होता है 24 25 डाइहाइड्रोक्सिल विटामिन डी एंड मेजर पाथवे से क्या होता है, किडनी से एंजाइम आती है 1 अल्फा हाइड्रोक्सिलेज दैट इज गोइंग टू ऐड हाइड्रोक्सिल ग्रुप एट वन पोजीशन. सो 125 डाइहाइड्रोक्सिल विटामिन डी3 फॉर्म होगा which is also known as calcitriol. This is the active form of vitamin D. क्लियर हुआ? कैल्सीडायोल क्या है, हमारा 25 हाइड्रोक्सिल विटामिन D3 है. कैल्सीट्रायोल क्या है, हमारा 125 डाइहाइड्रोक्सिल विटामिन D3 है. इज दिस क्लियर एवरीबॉडी? ठीक है, 125 डाइहाइड्रोक्सिल विटामिन D3 एक्टिव फॉर्म है. विटामिन D3 जो यहाँ फॉर्म हो रहा है वो इनएक्टिव फॉर्म है. एंजाइम की बात करेंगे तो लिवर से हमारा आ रहा है 25 हाइड्रोक्सिलेज, किडनी से आ रहा है वी आर गेटिंग दिस 1 अल्फा हाइड्रोक्सिलेज एंजाइम. So these all points are very important from exam point of view. Do remember what is a calcidiol, what is a calcitriol, from where the alpha hydroxylase enzyme come. 125 hydroxyl जो होता है वो active form होता है. So these all points are very important. Do remember everybody. So moving further to the action of vitamin D, GIT पे कैसा action है? It is going to bind. Vitamin D is going to bind. Vitamin D form this cal binding and that cal binding is going to increase the calcium absorption from the diet. Do remember this calcium absorption in the GIT exclusively occur in the duodenum. Is this clear? GIT पे कैसा एक्शन है, कैल्शियम एब्जॉर्प्शन को इंक्रीज कराता है दिस विटामिन डी. बोन पे कैसा एक्शन है, सेम एज अ पैराथॉर्मोन. इसकी भी रिसेप्टर कहाँ प्रेजेंट होते हैं, इट्स रिसेप्टर इज प्रेजेंट इन ऑस्टियोब्लास्ट. So rank ligand will be produced and that rank ligand is going to increase the osteoclastic differentiation and that is going to cause this bone resorption. Is this clear everybody? Moving further to the action on the kidney, what does this vitamin D act on the kidney? It increases the calcium reabsorption from the distal convoluted tubule. It increases the phosphate reabsorption. So overall action क्या हो जाएगा? It increases the calcium, it increases the phosphate. While the overall action of parathormone was, anybody? The overall action of parathormone was, overall action of parathormone was, it was increasing the calcium level but it was decreasing the phosphate level. So that's why it is also known as phosphate terminating or phosphatitonin. Is this clear? GIT पे कैसा एक्शन है, it increases the calcium reabsorption. और पैराथॉर्मोन का क्या एक्शन था, इनडायरेक्ट एक्शन था, it augments the action of vitamin D, so it is also going to increase the calcium reabsorption. किस पार्ट से कैल्शियम रीअब्सॉर्ब होता है, एक्सक्लूसिवली अकर फ्रॉम द ड्यूरेनम. Is this clear? Moving further to the disorder part, vitamin D deficiency in the children is going to cause this ricket. This occurs due to this deficiency is occurring before the epiphyseal fusion. So उसकी वजह से क्या होगा, ग्रोथ रिटार्डेशन होगा, डिफेक्टिव मिनरलाइजेशन ऑफ बोन्स होगा, जिसकी वजह से क्या होगा, वेट बियरिंग बोन्स इज गोइंग टू बेंड एंड दैट लीड टू दिस बोइंग ऑफ लेग. In adult, this vitamin D deficiency is going to lead this osteomalacia, in which क्या होगा, bony matrix का impaired mineralization will be seen. ठीक है. To access the vitamin D status, lab measurement of this 25 hydroxyl vitamin D3 is done. So this is important from the exam point of view. Lab measurement हम किसका करते हैं? हम करते हैं calcidiol का. 25 hydroxyl vitamin D3 is done. Is this clear? Moving further to the characteristic feature we will see in this deficiency of vitamin D, we will get this hypocalcemia, hypophosphatemia, and we can get this secondary hyperparathyroidism. And manifestation कैसा हो जाएगा? Bone pain, muscle weakness will be seen. So these are important signs and symptoms we will get in vitamin D deficiency. Moving further to this part, whenever the calcium level rises in our body, thyroid gland releases this calcitonin. This calcitonin is released by anybody? This calcitonin is released by parafollicular cell of thyroid, and this calcitonin is going to decrease the blood calcium level. And whenever the calcium increases to the set point, तो हमारे body से क्या release होता है? Parathyroid hormone is released, and that is going to decrease the calcium level. ठीक है? Is this clear, everybody? Moving further to the last hormone that is regulating our calcium metabolism, that is calcitonin. This calcitonin is released by parafollicular C cell. Drug form of calcitonin is calcitonin. Now coming to the action on the bone. The calcitonin receptor is present on osteoclast. Do remember. ठीक है. जबकि पैराथॉर्मोन रिसेप्टर और अगर विटामिन डी रिसेप्टर की बात करते हैं तो दे वर प्रेजेंट ऑन ऑस्टियोब्लास्ट एंड दे आर इंक्रीजिंग द ऑस्टियोक्लास्टिक डिफरेंशिएशन बाय इंक्रीजिंग द rank ligand production. But out here the receptor are present in osteoclast itself. So osteoclastic activity is going to inhibit it, and that is going to prevent the bone resorption. So calcium and phosphate in the blood will decrease since bone resorption is prevented. So moving to the kidney. It is going to cause this calcium excretion at the level of kidney. So overall action कैसा हो गया calcitonin का? It decreases the calcium level. Now coming to the clinical aspect. Medullary carcinoma of the thyroid is a tumor of this parafollicular cell. So this parafollicular cell का tumor होगा, it is going to lead the more production of this calcitonin. So that's why this calcitonin is used as a tumor marker for medullary carcinoma of thyroid. Is this clear with everyone? Do reply fast. किसी को अभी तक सेशन में कोई डाउट हो तो क्लियर कर सकते हैं. पैराथॉर्मोन विटामिन डी क्या कर रहा है? कैल्शियम लेवल को इंक्रीज करा रहा है, while this calcitonin is decreasing the calcium level. Everybody, is this clear? I guess इसके बाद क्वेश्चन पार्ट स्टार्ट होगा. अभी तक किसी को भी सेशन में कोई भी डाउट है तो क्लियर कर सकते हैं. Anybody, any query till now you can ask in the session only. To reply fast, moving further to the last point, I guess this is the hypercalcemia of malignancy. So calcium level increases during the malignancy, and this occur as a part of a tumor, and this occur exclusively in lung carcinoma like squamous cell carcinoma and a small cell carcinoma. So tumor cell is going to secrete this parathormone related peptide. So it is going to act like a parathormone, and parathormone, what does it do? It increases the calcium level, and so that's why there is hypercalcemia of pregnancy, because tumor cell is secreting this parathormone related peptide, and this is seen exclusively in lung carcinoma like squamous cell carcinoma as well as small cell carcinoma. Moving to the question part, which of the following are produced by endocrinal part of pancreas? Insulin, somatostatin, glucagon, bombacin, or pancreatic polypeptide? Excuse me. Everybody answer this question. Following hormones are produced by endocrinal part of pancreas. Everybody answer this question. Following hormone are produced by endocrinal part of pancreas. Insulin is produced, glucagon is produced, pancreatic polypeptide is produced, somatostatin is produced. So answer is A, B, C and E. Coming to the next one, insulin is or are secreted by pancreas, islet of Langerhans, liver, heart or intestine. Insulin is or are secreted. Clear one, everybody? Insulin is or are secreted by pancreas. You can say pancreas, you can say islet of Langerhans. So both are true. Answer is both A and B. Coming to the next one, glucagon is secreted by alpha cell, beta cell, delta cell, G cell or C cell. Glucagon is secreted by. Everybody answer this question. Insulin, glucagon is secreted by. Everybody answer this question. No, it is not produced by beta cell, it is produced by alpha cell. Coming to the next one, insulin is secreted along which of the following molecule in 1:1 ratio? Pancreatic polypeptide, glucagon, GLP-1, somatostatin or C-peptide. Insulin is secreted along which of the following molecule in an equimolar ratio? Excuse me. Insulin is secreted along with of the following molecule in an equimolar ratio. Insulin is secreted along which molecule? No, it is secreted with the C peptide in an equimolar ratio. Answer is E. Coming to the next one, insulin mediated glucose uptake occur through GLUT1, GLUT2, GLUT3 or GLUT4. Insulin mediated glucose uptake occur through. Everybody answer this question. Insulin mediated glucose uptake occur through. Everybody answer this question. Insulin mediated glucose uptake occur through. Do you reply fast? Yeah, very true. Insulin mediated glucose uptake occur via this GLUT4. Insulin act on glucose metabolism by increasing permeability of glucose across cell membrane, increasing permeability across cell membrane against glucose gradient, increasing permeability of renal cell, increases glucose transport to the brain. Everybody answer this question. Insulin act on glucose metabolism by yeah, very true. It increases the permeability of glucose across the cell membrane. Coming to the next one, glucose transporter in myocytes GLUT1, GLUT2, GLUT3 or GLUT4. Glucose transporter in myocyte is. Everybody answer this question. Everybody answer this question. Glucose transporter in myocytes. It is via this GLUT4. Glucose transporter in our myocyte, in our muscle, skeletal muscle बात करें, cardiac muscle बात करें, so it is via this GLUT4. Coming to the next, this is the summary. GLUT4 is present in blood, blood-brain barrier, heart to the lesser extent. GLUT2 is present in liver, pancreas and small intestine. GLUT3 is present in our brain, neuron and the sperm. and GLAT4 is present in skeletal muscle, adipose tissue and the heart. So heart consists of this GLAT4 and GLAT1 in the lesser extent. Moving further to the next question, not done by insulin. Glycogen synthesis, glycolysis, ketogenesis or lipogenesis. Hmm. Everybody answer this question. Not done by insulin. No, ketogenesis is not done by insulin. Insulin do the glycogen synthesis, it causes the glycolysis, it causes the lipogenesis, proteogenesis, but it doesn't causes ketone body formation. Coming to the next, rapid infusion of insulin causes hyperkalemia, hypokalemia, hypernatremia or hyponatremia. Rapid infusion of insulin causes rapid infusion of insulin causes. Everybody answer this question. Rapid infusion of insulin causes. Everybody answer this question. What happened? In the presence of insulin, glucose and potassium ion is taken inside the cell, so it is going to cause this hypokalemia. Coming to the next one, insulin secretion is or are increased by all except gastrin, secretin, vasoactive intestinal peptide GIP or the cholecystokinin. Insulin secretion is increased by all except everybody answer this question. Insulin secretion is or are increased by all except. Answer is none. Insulin secretion is increased by gastrin, secretin, vasoactive intestinal peptides, glucagon-like peptide, and the cholecystokinin. So answer is none. Coming to the next one, insulin secretion is decreased by glucagon, glucose, adrenaline, or the vagal stimulation. Insulin secretion is decreased by Everybody answer this question. Insulin secretion is decreased by. Everybody answer this question. What does glucagon do? It increases the blood glucose level, so it is going to increase the insulin secretion. Glucose is going to increase the insulin secretion. Vagal stimulation increases the insulin secretion. Adrenaline is going to decrease the insulin secretion. Do remember, sympathetic nervous system का overall action क्या होता है? Via the beta 2 receptor that decreases the insulin secretion. Coming to the next, insulin secretion is seen in glucose, acetylcholine, vagal stimulation, adrenaline, or the calmodulin. Insulin secretion is seen in. Everybody answer this question. Insulin secretion is seen in. Very good, Dr. Lakshmi. Glucose के presence में insulin secretion होगा, vagal stimulation, and vagal stimulation is going to release acetylcholine. So in all these three situations, glucose, vagal stimulation, and presence of acetylcholine is going to increase the insulin secretion. Is this clear? Coming to the next, in a seriously ill patient, addition of amino acid in a diet result in positive nitrogen balance. The mechanism of this is increased growth hormone secretion, increased rate of gluconeogenesis, increased absorption of amino acids from diet, increased secretion of insulin. So everybody answer this question. In a seriously ill patient, addition of amino acid in a diet result in positive nitrogen balance. The mechanism for this is everybody answer this question. Sorry, everybody answer this question. Do reply fast. In a seriously ill patient, addition of amino acid in a diet results in positive nitrogen balance. The mechanism for this is, देखो एडिशन ऑफ अमीनो एसिड्स करेंगे तो ना सीरियसली इल पेशेंट है उस समय क्या होगा, हमारा इंसुलिन प्रोडक्शन स्टार्ट हो जाएगा हमारी बॉडी में, हमारा प्रोटियोजेनेसिस होगा एंड देयर विल बी इंक्रीज एब्जॉर्प्शन ऑफ अमीनो एसिड फ्रॉम द डाइट. So there will be increased absorption of amino acid from the diet. Coming to the next, after a meal rich in a carbohydrate, insulin secretion is stimulated by. Insulin secretion is stimulated by cholecystokinin, serotonin, vasoactive intestinal peptide, or glucagon like peptide 1. Everybody answer this question. After a meal rich in a carbohydrate, insulin secretion is stimulated by. The most correct answer is glucagon like peptide 1, GLP-1. ठीक है? Cholecystokinin vasoactive intestinal peptide is also going to increase, but the most correct answer is GLP-1. It is also known as glucose dependent insulinotropic polypeptide. Coming to the next, the fetus. In fetus, the insulin secretion begin in 3rd month, 5th month, 7th month, or 9th month. In fetus, the insulin secretions begin by. In fetus, the insulin secretion begin by. Insulin secretion 12th week से start हो जाता है. So that's why the answer is 3rd month. No, it's not 9th month. It's from 3rd month or 12th week. Coming to the next, a myelin is secreted by which cell of islet of Langerhans? Beta cell, alpha cell, delta cell, or the gamma cell? A myelin is produced by which cell of islet of Langerhans? A myelin is secreted by which cell of islet of Langerhans? Everybody answer this question. A myelin is produced by. No, a myelin is not produced by gamma cell, it is produced by beta cell. Along with the insulin, along with the C peptide, all are produced by the beta cell. What does a myelin do? Anybody? What does this a myelin do? A myelin potentiate the action of insulin. Coming to the next question. Human insulin database question है, इसको skip कर दें. Coming to the next, to synthesize insulin on a large scale basis, the most suitable starting material obtained from beta cell of pancreas is. genomic DNA, total cellular RNA, cDNA or mRNA? Question is asking about the most suitable starting material that is obtained from beta cell of pancreas to synthesize this insulin. It is the most starting material is our mRNA. क्या होता है हमारा डीएनए से रिवर्स ट्रांसक्रिप्टेज एंजाइम जब एक्ट कराते हैं तो हमारा क्या फॉर्म होता है mRNA. फिर हमारा डीएनए mRNA कॉम्प्लेक्स बनेगा. mRNA इज डिस्ट्रॉयड बाय अल्काली. वी आर गेटिंग दिस सिंगल. इस पे जब एंजाइम एक्ट करेगा तो हमारा सिंगल स्ट्रैंडेड डीएनए बनेगा. सिंगल स्ट्रैंडेड जब डीएनए बनेगा उसकी कॉन्जुगेशन होती है तो कॉम्प्लीमेंट्री डीएनए बनता है एंड कॉम्प्लीमेंट्री डीएनए से इंसुलिन का फॉर्मेशन होता है. तो मोस्ट स्टार्टिंग मटेरियल की अगर बात करेंगे तो दैट इज mRNA. और इमीडिएटली किससे बनेगा? दैट इज cDNA. बट क्वेश्चन इज asking about the starting material only, so answer is mRNA. Is this clear with everybody? डीएनए पे जब रिवर्स ट्रांसक्रिप्टेज एंजाइम एक्ट करेगा तो एमआरएनए का फॉर्मेशन होता है. एमआरएनए से हमारा सिंगल स्ट्रैंडेड डीएनए बनेगा. सिंगल स्ट्रैंडेड डीएनए कॉन्जुगेट करेगा, डबल स्ट्रैंडेड डीएनए बनेगा जिसको हम कॉम्प्लीमेंट्री डीएनए कहेंगे एंड फ्रॉम देयर द इंसुलिन प्रोडक्शन occurs. Next question. Insulin resistance seen in a patient with a liver disease due to damaged hepatocyte, hepatic steatosis, impaired insulin release, low C-peptide level. Everybody answer this question. Insulin resistance is seen in a patient with liver disease. Everybody answer this question. Insulin resistance is seen in a patient with liver disease that is due to. लिवर डिजीज की वजह से क्या होता है? फैटी इन्फिल्ट्रेशन होता है जिसकी वजह से इंसुलिन रेजिस्टेंस इज सीन. सो आंसर इज बी. Coming to the next one, first response to hypoglycemia is decreased insulin, increased glucagon, increased cortisols, increased norepinephrine. First response to hypoglycemia is everybody answer this question. First response to hypoglycemia is Everybody answer this question. First response, all these are response we will see in hypoglycemia, but the first response will be decrease in insulin level. Answer is A. Coming to the next one, in surgical stress, all hormone is increased except adrenaline, adrenocorticotropic hormone, epinephrine, cortisol, or the insulin. Shall everybody answer this question? In surgical stress, all hormone is increased except. Do reply fast. In surgical stress, all hormone is increased except. Easy, I guess. सर्जिकल स्ट्रेस की अगर बात करेंगे तो ऑल हार्मोन आर इंक्रीज एक्सेप्ट इंसुलिन because insulin decreases the glucose level. Coming to the next question, stress induced hyperglycemia is due to glucocorticoid growth hormone, thyroxine, epinephrine, or insulin. Stress induced hypoglycemia is due to. Everybody answer this question. Stress-induced hyperglycemia is due to. Hyperglycemia. Question is asking about hyperglycemia. It is due to glucocorticoid growth hormone, thyroxine, and epinephrine. Coming to the next question, which of the following hormone is increased due to stress during surgery, especially in diabetes mellitus? Epinephrine, growth hormone, glucocorticoids, thyroxine. Same hai. Answer will be also the same. Coming to the next one, active form of vitamin D is cholecalciferol, 24-25 dihydroxyl vitamin D, 125 dihydroxyl vitamin D, 25 hydroxyl vitamin D. The active form of vitamin D is everybody answer this question. Active form of vitamin D is everybody to reply fast. Active form of vitamin D is, everybody answer this question. Answer is C, 125 dihydroxyl vitamin D is the active form. Calcium absorption is from proximal small intestine, distal ileum, middle small intestine, and acidic colon. proximal small intestine, distal ileum, middle small intestine, or ascending colon. Calcium absorption is from everybody answer this question. Calcium absorption is from duodenum, that is proximal part of small intestine. Answer is A. Coming to the next one, true of the following: calcium reabsorption occur from the DCD. 90% of calcium excreted by the glomerulus. Parathormone promote absorption of calcium from the intestine. Parathormone promote action of calcitonin. True statement among all of these four. Everybody answer this question. True statement among all of this following. First statement is true, calcium is reabsorbed in DCD. 70% हमारा reabsorb हो जाता है. पैराथॉर्मोन promote absorption of calcium from the intestine. ठीक है. This is also wrong. It promotes only the action of vitamin D and not the calcitonin. So answer is A only. This is clear with everybody. Coming to the next true statement about calcium: absorbed in upper small intestine, absorbed in lower small intestine. Absorption increases by alkaline pH, absorption increases by acidic pH. True statement about calcium is, everybody answer this question. Everybody answer this question. True statement about calcium is, it is absorbed from upper small intestine. True. Absorption increases in acidic pH. Acidic pH में क्या होगा? H plus ion is going to bind with the albumin. उस situation में क्या होगा? Free calcium will be more, so there will be more absorption. So answer is A and D. Is this clear? Coming to the next one, which of the following organ is not involved in calcium metabolism? Lung, liver, spleen, kidney, or skin? Which of the following organ is not involved in calcium metabolism? Which of the following organ is not involved in calcium metabolism? Everybody answer this question. देखो विटामिन डी के फॉर्मेशन में हमारा स्किन लंग लिवर्स आर इन्वॉल्व सो दे आर इन्वॉल्व ठीक है kidney is also involved only and only answer is C spleen is not involved in the calcium metabolism coming to the next one parathormone is responsible for all action except ठीक है absorption of phosphorus increases vitamin D absorption increases mobilizes calcium from the bone increased intestinal absorption of calcium parathyroid hormone is responsible for all action except parathyroid hormone is responsible for all action except it is phosphate terminating it doesn't causes absorption of phosphorus it causes excretion of phosphorus so answer is A coming to the next one in tetany hyperexcitability is due to low calcium causes increased permeability to sodium prevent calcium potassium release prevent sodium and potassium release decreases the calcium produce decreased calcium produce generation of action potential. Everybody answer this question. In tetany, hyperexcitability is due to do reply fast, everybody. In tetany, hyperexcitability is due to low calcium is going to increase the permeability to the sodium and that is responsible for hyperexcitability in the tetany situation. Coming to the next one, hypocalcemia due to calcitonin is due to increased extraction in the kidney, decreased bone resorption, decreased intestinal absorption or decreased renal absorption. Hypocalcemia due to calcitonin is due to everybody answer this question. Hypocalcemia due to calcitonin is due to hypocalcemia due to calcitonin is due to because calcitonin is decreasing the bone resorption, so that's why it leads to the hypocalcemia. Answer is B. Coming to the next, which of the following is considered as an active form? Ionized calcium, albumin bound calcium, phosphate bound calcium, or the protein bound calcium? Which of the following is considered as an active form of calcium? Everybody answer this question. Which of the following is considered as an active form of calcium? Everybody answer this question. Active form of calcium are the free form. They are not bounded with anything. Free form ionized calcium are the active form. ठीक है? So answer is A, not B. It is protein bound. It is not active. No. Albumin bound, phosphate bound, protein bound, all are the inactive form of calcium. Only the free form is the ionized form, and that is only the active form. Coming to the next, which of the following organ is not involved in calcium homeostasis? Kidney, skin, intestine or lung? Same है, I guess कर चुके हैं, skip करते हैं. Calcitonin is secreted by thyroid gland, parathyroid gland or the adrenal gland. Easy, I guess. Calcitonin is secreted by everybody answer this question. Easy, I guess. Calcitonin is secreted by parathyroid gland. Very good. Coming to the next one, osteoclasts are inhibited by. Osteoclasts are inhibited by parathyroid hormone, calcitonin, 125 dihydroxycholecalciferol or tumor necrosis factor. Osteoclasts are inhibited by. Everybody answer this question. Osteoclasts are inhibited by. Osteoclasts are inhibited by our calcitonin. Coming to the next. No, it's not tumor necrosis factor. Calcitonin क्या करता है? Osteoclast की activity को inhibit करता है. It inhibits the bone resorption. So it decreases the calcium level, already discussed in the session. Coming to the next. Osteoclast has a specific receptor for parathyroid hormone, calcitonin, thyroxine, vitamin D3. Everybody answer this question. Osteoclast has a specific receptor for osteoclast has a specific receptor for easy, I guess. Very true. Calcitonin has its receptor on osteoclast, so that's why osteoclastic differentiation decreases. So that's why bone resorption is prevented in the presence of calcitonin. Coming to the next, which of these can cause hypocalcemia? Thyroxine, calcitonin, parathyroid hormone, cholecalciferol. Easy, I guess, ये भी. Which of these can cause hypocalcemia? Which of these can cause hypocalcemia? No, it's not parathyroid hormone. Parathyroid hormone क्या करता है? It causes hypercalcemia. ठीक है? Vitamin D also causes hypercalcemia. Thyroxine has no role. Only and only calcitonin is going to cause this hypocalcemia. Answer is B only. Coming to the next one. Which of the following would you expect to find in a patient whose diet has low in a calcium for 8 weeks? Increased phosphate level, raised calcitonin level, increased parathyroid hormone secretion, activation of 24-25 dihydroxycholecalciferol. Everybody answer this question. What will you expect? कि हम एक्सपेक्ट करेंगे कि पैराथायरॉयड हार्मोन सिक्रीशन इंक्रीज होगा और एक्टिवेशन ऑफ 24-25 डायहाइड्रोकोलिकॉल्सिफेरॉल इनटू 125 डायहाइड्रोक्सीकोलिकैल्सिफेरॉल. या पैराथ हार्मोन के साथ साथ एक्टिव फॉर्म ऑफ विटामिन डी आल्सो इंक्रीजेस टू इंक्रीज द कैल्शियम लेवल. सो आंसर इज बोथ सी एंड डी. इज दिस क्लियर डॉक्टर लक्ष्मी? इज दिस क्लियर डॉक्टर आजाद? कुछ क्वेश्चंस रह गए, नेक्स्ट सेशन में ले लेते हैं. 2-3 questions were left. आज के सेशन में किसी को कोई डाउट, एनीबडी, एनी क्वेरी टिल नाउ, यू कैन आस्क इन द सेशन ओनली. Hope you all like the session. If you like the session, do like and share. This is important. जितना ज़्यादा share करोगे उतनी class interactive होती है. So do share everybody. Most welcome Dr. Lakshmi. Most welcome Dr. Azad. अगर channel को subscribe नहीं किया तो subscribe कर लीजिए. Our channel is Let's Crack Neat PG and press the bell icon so that you will get notification of every class and you won't miss a single class. ठीक है, यही पेज हमारा टेलीग्राम पे भी है, वहाँ पे भी जाके फॉलो कर सकते हैं सो दैट यू विल गेट लिंक ऑफ एवरी क्लासेस. रेगुलर मेहनत करते रहिए, यू विल डेफिनेटली एबल टू अचीव योर टारगेट विद गुड रैंक. दिस इज द रेफरल कोड Dr. Nidhi. If you want to join any paid course, you can use this to get additional 10% off. This referral code is valid for each and every examination. If any friend of yours or any family member of yours, if they are willing to take Unacademy subscription, they can also use this referral code to get additional 10% off. That's all for today. Thank you so much for joining. See you all in the next session. Bye bye everybody.